like it almost plays like a movie in my head. Like just
Yeah.
having those suits like hung there, they just looked exhausted. If you could imagine it,
You're like,
and like I just pictured the people in them just hanging there to dry too, and it's just
right.
like everything is so exhausting.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement because we all know emergency nurses have the best stories. Now, here's your host, Kevin McFarland.
Hey, everybody. Kevin McFarland here from the Art of Emergency Nursing, and I hope you are having a good 2021. It is, if you're listening to this in real time, it is January of 2021. And I have one last, for a while anyway, COVID episode for you. This is an episode I recorded a while back with my friend Jessica, and she had just a great story. Now, this story may be a little tough to listen to, and it may bring back some feelings that you may have or maybe are going to have. So just keep that in mind when you're listening. I want you to take a listen and remember a couple things. That during these pandemic times, this has been one of the hardest times for emergency nursing I think many of us have ever experienced. And I just want you to remember to take care of yourselves. Remember to give yourself a little extra grace. Give a little extra grace to those around you and realize that we're all going through a pretty tough time right now. So, and one thing that's important is it's okay to not be okay. There are going to be times when you're not okay, and that's all right. That's to be expected. What I will encourage you to do is reach out to a friend, talk to your peers, talk to your friends, and let's have some conversations. Let's have some conversations about what we're going through, because there's a lot of people going through this right now. So not going to get too deep into this, but what I want you to do is let you know that we're out there. We're here together. You and I, me, you, and my guests are all here together, and we're going to get through this thing. So enjoy this episode with my friend Jessica, and I appreciate you listening to the podcast. Yeah, no, just kind of tell me a little bit about what your experience was, and talk a little bit about your hospital and kind of what was going on and what your role was, and I may ask you some specific questions, but it's not nothing super formal.
Sure. So yeah, I'll fill you in on all of that, but the thought that I just had now that I wanted to share was just this kind of crazy, almost PTSD type of experience I had maybe 2 weeks ago. Working back in the ER after having done the COVID ICU for 6-8 weeks. I don't even remember how many weeks I gave up over there, but I had an ICU patient in the ER, and, we have to take the patients over there. Mm-hmm. And it was the first time I had been back in the ICU. And now here we are, like, the place is like a ghost town. It was so surreal.
I bet.
I had not walked into the ICU since when I walked in my spacesuit. So here I am just in scrubs, and we all wear surgical scrubs. We're not allowed to wear our own. We have to come in and change before we leave the hospital, which is great. But so here I am just in scrubs and a mask, and it was kind of weird to walk in and not have to suit up and everything. But then to go in, and it's like just weird and eerie and clean. There's not plastic drapes everywhere. You don't have the hall cluttered with IV pumps that are like with all these long lines taped to the walls so people don't trip over it. Just complete chaos and tons of people, and everybody's in, the white suits with the respirators and the hoods and all of this. You don't know who a doctor is, who a nurse is, who anybody is. I mean, It was just a chaos zone, but here, none of that existed. It was like I wasn't even in the same place. And it was fine, and I dropped off my patient and, got my patient settled in the bed with the ICU nurse, and I walked out, and there's still all the coloring and signs. When I was working in the ICU, my neighbors have just been, I live 15 minutes from the hospital, and honestly, it's just bizarre. I don't know if you've ever been in a city where it's like you can have like a very wealthy population and then you just walk across the street and it's ghetto. Like this is kind of that setup
It's
where
totally
we have
Houston.
we have a very wealthy neighborhood, and then I just go 15 minutes north where I work, and it's a super underserved population. So anyhow, I come home, when I'm home and I'm telling the story, and everybody, it's right at the beginning of COVID, everybody wants to know about it, and how can we help? And they're awesome. They put like a sign up in my yard, Hero, lives here, and everybody wanted to do whatever they could to help, making masks, all of this stuff. And I said, what would really help? And your kids are all home with nothing to do right now because they're, going crazy. If you guys could just give me artwork, if you guys could make something just innocent and cute and just something I could hang up in our ICU. It's such a depressing place. Everybody's dying. Nobody knows each other. I don't even know. I haven't even worked in the ICU there. I don't know who the doctors are, who the nurses are. And the nurses don't even know who the nurses are because they're from, they're travel nurses from other states. We're just crumbling. We're busting at the seams with patients. So we just have it's just chaos. And it's just, and people are just dying. We don't have a ventilator for a patient. And you literally just have to watch somebody die. Like that doesn't happen in the United States.
Yeah.
How is it? This is not a DR, the patient's not a DNR. It's, why are we not doing CPR on this? Like, it just, this whole ethical, moral trauma, like, just a horrible place. And not that I explained to this extent to my neighbors, because I think they would,
of course not,
just drop dead. Like, lay population gets pretty overwhelmed when a healthcare worker's like, as, I don't know, traumatized, I guess, as I have been at that time, especially.
Yeah.
But I was just like, they would just be so great if you could do this. And so I just had all of these awesome, you guys are heroes, keep up the good work, keep your head up, like all of these adorable, sweet, colorful things. And I plastered them all over the ICU, all over the plastic, all over the walls. Like, so when the nurses are just stressed out, they can look up and just see this cute little thing that's an 8-year-old drew that says, "You're awesome. You're my hero." Like,
that's cool.
just something. And so a couple weeks ago to walk in there, well, like I needed, like, when people say, "What can you do to help?" Like, your first thing is like, there is nothing. The world is on fire. Like, and what can you do? Like, I feel like I can't even help, and I'm right there,
Right.
So I don't know, the idea had just come to me, but so here I am dropping off this patient after, the storm has come and gone and the ICU is totally clean, but the pictures were still there.
That's cool.
And I got just these goosebumps of like, I felt like I was in like where a bomb had dropped. And like those movie scenes where it's like you look over and you just see like this little baby doll from like some kid that was there that's now been
some
dead
total
and gone.
dichotomy of
Right. And then like, we used the stat locks for Foley catheters.
Yeah.
On the thigh. Well, we use those on the door frames to hold the IV lines. So they would go into the room and come out into the hallway. Yep. And like I saw just like one random kind of gross one actually still stuck to a door frame on a room. And I'm just like, it's just so surreal. And I don't know if I ever posted it on Facebook. I tried to be careful what I posted. I don't want to get in trouble. But I have a video of when I worked in the ICU. The ICU waiting room became like kind of a decon room. That's where everybody we had to reuse these disposable suits. Okay. Yeah. So when you took them off, everybody just had their name scribbled on it, and you took it off and you hung it up to dry literally on a clothesline with a little clothespins, and you sprayed it down with whatever Cavicide type of thing. And then you let it hang there. And I took a video one time when I came in for a shift of me walking in. there were just hundreds of these suits, and you had to try and find yours. You just hope nobody moved it from where you hung it up. Just lines and lines of these suits hanging there. And just to think of like, it's just like a 30-bed ICU.
It's crazy.
And to think about the number of people that have been coming in and out of there, like the resources, and it's just, I don't know, every time I looked at one of those suits and it just kind of like hung there, and I'm not a very poetic person, but I just feel like so much of this is so, like, it almost plays like a movie in my head. Like, just having those suits like hung there, they just looked exhausted, if you could imagine it, you know? I just pictured the people in them just hanging there to dry too, and it's just like, everything is so exhausting. But, you know, as far as like, you know, people that haven't been hit, and hopefully they won't be, but people that are like, oh my gosh, what's it going to be like if this just turns into a complete shit show here like that?
Yeah.
And it comes out of nowhere like a train. Like we prepared for it as much as we could and taped off areas of the ER, and we had a tent outside to screen people that had, you know, symptoms. And then just, it was almost like it was overnight. Our ICU was full. And then, you know, they shut down everything where, you know, people can't come visit. You can't do elective surgeries. And so the surgery center became the second ICU. And then that wasn't enough. And then so part of the ER became, you know, a third ICU. And it just, and then all of a sudden we had international medical volunteers there and a big, huge military tent out in a parking lot taking patients. Like, it literally happened. It seemed like overnight. And it was just this mad scramble. And I'm not in administration. Their heads had been spinning, but they were just so desperate. And the ER wasn't as busy as the whole rest of the hospital because people were afraid to come in unless they were not breathing, unless they were COVID, like sick patients. So the fast track, you know, area with your ESI 4s is empty, and that. But even though our census was down, what came in was the acuity was so high and consumed so much time. You know, you get a radio call in and somebody's coming in with shortness of breath and a fever. And it's like, okay, everybody's got to suit up. They got to zip into that room. They've got to, you know, and then you're in that room and then you got a decon to come out. So to take care of one patient was just this full out effort. And then, you know, you get them intubated and everything, and then you got to send them to the ICU. And then that's where everything was crazy. And they asked, you know, administration asked any nurses in the hospital if they would do like the next schedule or whatever in the ICU. The thing was, but we can't train you. Like,
well,
all right. So only ER nurses are kind of crazy enough to do that. But I had worked ICU for like 7 months way back in the day because I thought critical patients were cool. And then I realized they're only cool in the ER when they're a disaster. They're really boring once they're in the ER because they're in the ICU because the ER stabilized them.
Right.
But I'm like, okay, I kind of know ICU, and I'm a team player, right? Like, I really couldn't go into work in the ER and be like, you know, everything's kind of cool here. The whole neighborhood, like the whole area, we got so much food. I mean, talk about gaining 15, the COVID-15 or whatever people are calling it. Like, they fed healthcare workers around here like it was going out of style.
Oh,
and so,
Houston too.
And
Houston too, like every restaurant that wasn't working, and they were just like, well, we got to get rid of this food.
Right.
So they're just like
and they always drop it at the ER.
Yeah, they were just bringing piles and piles of meals to where the ER director was like, oh no, give that to like the ICU or something. Like we don't need that.
Well, I kind of felt like these people are out of work. How about we like go deliver it to food banks or give it to the homeless under a bridge? Like,
yeah, like find some.
I don't.
Yeah, find some like
they can't afford it.
Yeah, find some like oil and gas workers that can't work right now.
Right. So, I mean, not that we didn't appreciate it. I mean, I don't want to sound, you know, ungrateful, like, don't give it to us. But it just seemed kind of crazy to come into the ER and kind of be treated like these heroes and get all of this stuff, but not be getting your ass handed to you and know that ICU is down the hall, you know? So it's like, I'll go. And I didn't get any training. And I'm like, all right, I can keep people alive. Or so you think you can until you take care of COVID patients.
Right.
I said, but my charting's really going to suck. And
they're like, we don't care.
Right. It was just like, yeah, we don't care. Nobody's going to get in trouble. Like, it's just all hands on deck. It's a war zone, literally. I think there were policies put in place that, you could get away with violating policies. So I went there, and it's like my first day, it's like, here's your 3 patients. And I'm like, wow. Like, normally an ICU nurse is 1-on-1 or 1-on-2. I'm not even an ICU nurse, and I get 1-on-3. Great. And I'm like, so how do I get into the charting here? Because of course it's different than the ER, and like trying to get that set up, trying to get in the PICSAs, but I still have patients that I just got assigned to me. And, you take, report from the night nurse who just got there from Nevada that knows nothing. And they're like, yeah, well, he's got COVID and he's on a vent. Here you go. Like, it was almost an ER report. So I kind of had respect for it.
Yeah, you're like, yeah,
but
all right,
I was
whatever.
like, yeah, the pulmonologists that I worked with were just phenomenal when I was like, I don't understand. Like, what am I, it's like, okay, we're going to do a sedation vacation and try and wean him from the vent. And I'm like, all right, I kind of sort of remember that from like 10 years ago, but can you explain to me how I do that? Because in the ER, we put them on vents. We don't take them off vents.
Right.
So
you're like, this is not really my thing.
Yeah. And then we ran out of vents. So we were using a machine called AVAPs. Have you ever heard of that?
AVAPs. I've heard of it, but I don't know right off the top of my head what it is.
To my understanding, they use it a lot in like pediatric critical care.
Huh.
But, and I'm totally going to forget what it stands for, but I was really frustrated. I had this night nurse giving me a patient, and they're like, yeah, he's on AVAPs because he kept extubating himself.
You're like, what?
So we put him, yeah. And so we put him on AVAPs. I'm like, what's AVAPs? And he goes, well, it's, the machine's kind of like a ventilator. It has all the ventilator capabilities, but it's with a mask like BiPAP. And I was like, okay, well, what does AVAP stand for? And he's like, I don't know. I'm like, what do you mean you don't know? Don't you? You took care of this patient for the last 12 hours and you don't even know what the machine does?
Yeah.
No, it's just kind of like a ventilator. And so after I got report and everything, I asked one of the ICU nurses that I did know actually worked there, because I've actually given her patients in the past from the ER. And I'm like, hey, what does AVAP stand for? She was like, I don't know. And I'm like, okay, this is ridiculous.
You're like, it doesn't matter. Just use the machine.
Am I the only one that cares to know what's going on, like the equipment that we use, like how it works? Like, what if something goes wrong? Like, what if, not that we could have any family there, but I've always had this thing, like, if I walk into a patient's room and a family member asks me, what is the medication you're giving, or what does that machine do, or why does he need this? I better be able to answer. I don't want to be like, I don't know. Like, it's my job to know. So I was really frustrated with that. But I asked this one pulmonologist, and he explained it to me. And I'm going to screw it up if I try and remember exactly, but it's like averaged volume assist pressure support or something like that. But what it basically is, this machine that is like a smart machine and like senses the volume that the patient inspires. It provides support like, a BiPAP and stuff like that. But it's not pressure support, it's a volume support.
Huh. So
it's really interesting. But nonetheless, I never knew that thing existed. And I don't know that I ever would have if it wasn't for COVID and we ran out of all of the vents. Yeah. But it's like, here I have this patient with a machine I know nothing about, and I've never been trained on it. And, he was only in his 40s, and he actually also had tuberculosis, which came to visit because he had COVID, and we called it what were we calling it? Coverculosis.
Wow.
Just sick as all get out. That same shift, I had a 27-year-old that had COVID, and her only history was asthma. And she was on a vent, and I can't tell you how much heparin she was on because her D-dimer was crazy high. And this is something, and I still don't know if they've figured out what this whole coagulopathy deal is with COVID. But not only did everybody have weird coagulopathies, well, not everybody, a lot of them did. Everybody had weird glucose issues. Everybody's glucose was super high, whether they were diabetic or not. It's almost like they just became a diabetic with this COVID. It was crazy.
I haven't heard that.
So so, I mean, who knows? I mean, maybe it's a bizarro thing where I worked, but I've heard it from other people too. So everybody was on an insulin drip, which is great because that keeps you busy taking blood glucose every hour, and you don't have techs, right? Because that's just how it is. You have nothing. You have no resources. And so she's on this crazy high, dose insulin drip. And of course, all this blood started coming out of her ET tube. Wow. And like her lungs are like literally melting. So I called the pulmonologist. I'm like, what do I do? It's bright red blood. And the pulmonologist came in and irrigated her lungs and suctioned all of it out. And she's like, there's not much you can do but stop the heparin. Duh, that was done. Thank you. Yeah. But, that was going on. I actually had 4 patients when all of this was going on, which was crazy. And I had a patient that he actually wasn't a COVID patient. I don't know why he was in the ICU, but I swear he must have been because he actually was an overdose. We don't know if it was a suicide attempt or not, but he was brain dead, and we were trying to just get him out to a long-term facility. He had a central line, and central line just out of nowhere started bleeding.
Wow.
Like under the dressing.
Crazy.
And I couldn't get it to stop. And I'm like, there were just all these weird things like that. And I don't know that you can be prepared for any of it. And, I had a patient that I got towards the end of one of my shifts in the ICU that she, the week before, came in to the ER with trouble breathing, 38 weeks pregnant. They intubated her into the crash C-section. She was in the ICU for a little bit, got better, got extubated, was taken up to telemetry, but then she started to go south again. Put her on high-flow nasal cannula, but she was super anxious and, scaring the tele nurses. So they brought her back down to the ICU. And that was the first time I knew this. I got that story, but this was the first time I encountered her, took care of her. And, I don't know if I've talked to a few nurses about this, and I don't know, Kevin, if you've ever experienced this. But I've actually only experienced it with like real critical patients, very rarely in the ER, but it happened actually a lot when I did that, my 7-month stint in the ICU. But where you go into a patient's room and you just know they're going to die. Yeah. And I know that sounds horrible. And it's not like, because you look at them and they're working so hard to breathe and they're mottled or, like they're tanking.
It's not all the obvious stuff.
Right. It's the sense in the room that it's almost like a sixth sense, as weird as it sounds. I'm not. Yeah. I'm definitely a black and white left brain science person, and I don't subscribe to really anything that doesn't have good data behind it. But I can't deny this. When you get a really bad feeling about a patient, it's like something without really knowing what you know. And I had that about her, and she was talking to somebody in the room that wasn't there. And I really felt, and call me crazy, but I really felt like it was a dead relative of hers or somebody coming to get her, kind of like as crazy as that sounds. And the pulmonologist was like, she's just hallucinating. She's going through like fentanyl withdrawal because we took her off the fentanyl and sent her up to the floor. And hey, maybe she's right. But I just didn't feel like that. And I'm just like, whatever, and I gave her over to the night shift nurse, and what no other nurse wants to hear from another nurse is, I feel really shitty about this patient. I can't tell you why, but keep an eye on her. It's like, oh, great, thanks. Thank you for giving that to me. And then I found out a day later, I got a call from a friend of mine that works in the ER, and she told me she died. And she's 38. She had a 5-year-old. I talked to her about her 5-year-old, and I talked to her about her 1-week-old baby that was the crash C-section the week before that she's never been able to see yet.
Jeez,
because
Louise.
she's been in the hospital, only over an iPad. I talked to her husband on the phone and let him know that she's in the ICU now. We were going to take care of her, and now it's like she's dead. And it's like, COVID's not supposed to kill pregnant people. This was at the beginning. Pregnant people aren't supposed to get it.
Yeah.
She's 38. She had no medical history. She did have gestational diabetes, but that was it. And right after she told me that, she said, by the way, came in by ambulance. Is, the nurse that I told you about, 26 years old, ER nurse. She's been a nurse for like 2 years. She's phenomenal. And she volunteered to work the ICU, which I think is just insane. Only being an ER nurse, or a nurse at all for 2 years and willing to take that on. But she rocked it. She got COVID and she ended up in the ICU. She was in the hospital for 11 days. But
Wow.
I'll tell you, when I got that phone call and heard that patient had died, just came in gray, not doing really well at all, and they were afraid they're going to have to intubate her. I lost it. That was like the day that I just had to walk outside my house and be like, I can't. Like, yeah, that was like, it's still hard to think about it. Like,
Yeah. Holy cow, I bet.
Like it's so real. I mean, it's real when you're there and you walk in and you suit up and you're all day in this space suit surrounded by people you hardly know, doing a job you really don't know how to do, taking care of patients with some illness nobody knows how to take care of, and codes being called that nobody goes to because we don't have a vent and they're 70 or whatever. So just, it is what it is. And it just, the craziness of that, is almost like palatable. Like, okay, and I'm an ER nurse, right? Like, suck it up. Like, there's no crying in nursing. And, you see drowned babies, you see horrible car accidents and young teenagers that die in drunk driving. And I really tried to sit there and figure out in my head, I'm like, how over the past 13 years have I seen such horrible things like those I just mentioned and been okay with it? Not that I obviously was upset about those things. They're horrible, but why can I not deal with this? And I realized it's because, in emergency nursing, you see the worst things in the world that can happen to people.
Absolutely.
But you're also a part of the best things that happen to people. You get to be there to make the worst day of their life
better.
End up being a memory of them going, thank God that nurse was there. Thank God I had her or him or whatever. But I'll tell you, those horrible days, there's like that's one of like 1,000 great days. The majority of the days you TPA'd somebody that was full on left-sided deficit that's now moving in their arms 10 minutes later. Like, these people had a massive stroke that could have just changed their entire life, and you were one on the team that helped get them back with that TPA, or the massive MI that coded and you got it back, and coded and got him back, coded and got him back, and then he went to the cath lab, and then he walked into the ER a week later to say thank you. Like, all of those stories there's way more of those than the bad stories that break your heart. But this whole COVID crap, every story was a bad story.
Yeah, it's true.
And maybe on the floor, we did have an entire floor of COVID patients, and they would, those patients, for the most part, because they were, up on the med surge floor or whatever, they got better and went home. And, maybe it was easier. I don't know. Probably not. I don't think anything was easy for anybody, but it may have been easier for those nurses to actually be able to discharge patients home. But I never discharged anybody home. You know, it's like everybody's dying. And then to have that new mom, she was the first ICU patient I had there that was not intubated. Like, I could actually talk to her and know her a little bit anyway before the end of my shift. And I tried to, cheer her up and let's get the iPad and you can see your daughter and, stuff like that. And to hear that she died, and then that same phone call to know one of my baby nurses, here I'm this nurse educator and I take all of these younger nurses under my wings. I absolutely love them. And I'm just like, to know that she's there now. And what do you mean she's gray? Like, don't say that. Like, I can't, it's now, even being in the ICU, seeing people die, it was like, it still wasn't that close to home, but to hear that she came in by ambulance and that she's critical was like that they got so close to reality that it just killed me. But she's better now. I don't know. She was discharged by Gemini. I have to ask her. I wonder if she still has a completely irregular heart rate for them. Yeah.
I actually, while you were talking, I just sent her a text message and said, "Hey, I'm gonna send you a link to a calendar and see if maybe we can figure out a time to talk." So
I'll tell you, not
holy cow.
Girl, she's a phenomenal person. She's a great nurse, but she is freaking hilarious too. She's like stand-up comedy.
Oh,
I love to work with her. I hope you do interview her because she's hilarious. I'm like, you need to be like, she reminds me of like Amy Schumer or somebody. She's just funny.
That's awesome.
But now, it's like a ghost town there, and the COVID patients we get in, it's like they don't even come in because they're COVID patients. We get a lot of critical patients come in, from the nursing home for like the typical things that they come in for, and we swab everybody now, and we have the rapid machine so we can get it back in 15 minutes. And you have this patient that comes in and you didn't even think they were COVID, and you're like, oh, COVID positive. That's great. Because not that you're not taking precautions, but you're just in there with a mask now. It's not like the full-on respirator and hood. And
and so often that was the case where, like, I know one of the things we started finding when patients started coming back, we were like, okay, anyone who says anything about having respiratory distress or anything, you go down this way, you go down to our little tent there. And if you're here for a broken arm, then you come on in here. And then we're like, oh, you have a broken arm and COVID.
Yay.
And you're like, holy shit.
Yeah. But
wow.
But I don't know. I mean, the administration did really, I think they did pretty phenomenal with the PPE. Of course, we had to reuse stuff. Everybody did. But they, our chief nursing officer is an emergency nurse. So,
that's nice.
So she's not that far from when she was down at the bedside.
That's
so
good.
she keeps it real.
That's good.
Yeah. But it's so funny. It's just so different. And I just feel so bad for those hospitals now in the South that are getting hit. And, to see all the stuff. And I even have neighbors that are like, oh, it's not real. Like, I can show you photos. I posted I have a closed Facebook group that I'm in because, that's my little community. And I posted on there, I think it was the Monday after, the day that I had that pregnant lady I was talking about. It was a really, really long shift. And I come home and I drink wine and I don't really process it till the next day until I'm not exhausted and I am sober. And So I was just sitting there, having my cup of coffee in the morning, and something just, I hate to use the word trigger. I hate when my kids use that. I'm like, oh, if I'm triggered you, get over it. Stop it. But but now I almost feel like, okay, I understand this term, because a lot of things, we used to say things piss you off. Now they trigger you. But I saw something, I don't even remember what it was, but it's just so frustrating. You know, people like the numbers, so they don't even mean anything.
Yeah.
And it was something to that effect. And so I put this post up and I said, for those of you that want real news as to what's going on, and I typed this up, I should send it to you, but it's just a post, and it really, I don't want to say it was venting, because it wasn't negative or anything like that, but it was just kind of raw. This is what's going on 15 minutes north of us. But I posted this thing, and it literally went viral within my community. And, you know, people actually were pretty great for the most part and supportive. And one of our local news anchors, I didn't even know he lives here, and his wife reached out to me, and she's like, he wants to interview you based on the story that you told. And I'm like, oh, okay, well, I don't want to get in trouble at work. Like, this is the time when like all these nurses were getting fired by saying they have to reuse their PPE or stuff like that.
Yeah.
And so I reached out to my friends, the CNO, and I said, hey, can I do this? Like, people should know reality. I'm so sick of everybody thinking this is a conspiracy and that masks are stupid. And, you know, it was really towards the beginning where we really didn't have everybody wearing masks in public. And I mean, I know in some states they don't. It got it together, but of course there's still a bunch of people that think it's, you know, against their constitutional rights or something. I don't know.
Right.
But
when did it become so political?
I don't know. I'm like, it's okay for people to say no pants, no shoes, no service, but they can't require a mask. Like,
it's just
whatever.
dumb.
I mean,
yeah.
I know. I don't get it, but I think it's because everybody's just agitated and has nothing better to do right now
right.
than get upset about stuff. But anyway, I guess the marketing or PR person at the hospital was like, no, it makes us look bad. And I'm like, every place is a disaster right now. The whole world looks bad. And it's, you know, I wasn't trying to make the hospital look bad. I mean, it looks dire, but our team is awesome, you know, and the community just really rallied for the most part to help out. And I really, you know, it was just a story of view from the front line. And, you know, it just ended up in a local newspaper and that kind of stuff. And so it was crazy, but it came in like a storm. And I kind of worry that we're kind of in the eye of the storm now, and it's going to come back. You know, you never know. People get second rounds of this stuff. And, you know, all of our schools locally are just I found out today that high school, my son's in high school, that's going to be, at least in the fall, completely online. And so it's weird, but, you know, when this all started and we saw what happened in China, and then watching all that stuff that happened in Italy, and everybody's like, oh, that's not real, you know, because it's in Italy, right? And then it hit New York, and then you see like New York get hit like crazy, and people saying, oh, it's not real, it's just, you know, people are exaggerating it. And I'm going to tell you, when it hit here, it came out of nowhere. It was like, okay, a few trickles for a week or two of people coming into the COVID tent to get swabbed, and then boom. And, you know, our heads are really still spinning. Half the ER got sick. I mean, I don't know, the floors and stuff may have as well. But the crazy thing about it now is that nobody's coming in. Everybody's afraid to come into the hospital. So they come in if they're damn near dead because they haven't taken care of themselves and come in when they should have. Some people are coming in for the, you know, the minor stuff. So we'll get fast track, we'll get a little bit busier. But because we're not seeing the numbers, you know, all of the secretaries throughout the hospital got laid off.
Yeah.
You know, doctors having to take pay cuts. A bunch of doctors have been furloughed. And so for a per diem like myself, Like aren't any shifts.
Yeah, there's just no space for you.
know, right. There's no patients for you.
Yeah.
And so it was just crazy. And I just worry all these people getting laid off and furloughed, going and finding another job, and it comes back and hits, and we're even in a worse case than we were before.
Right.
But
that's my worry. Texas still hasn't got, Texas is certainly surging. I mean, our numbers are going up and they're higher every day. But we haven't really gotten hit. Like we're not, I shouldn't say we're surging. We're busy. We're busy, but we're not surging. We're not getting our asses kicked right now. But our ICUs are all full.
Right.
So.
Yeah, and that's the thing. What was crazy, though, is when we were busting at the seams, you have a hospital 30, 40 minutes away is empty. Their ICUs were empty. And it's crazy because you can't just, I saw that they did it in New York. They had these buses of people they just put on it and sent out. But it's we couldn't just send these to these, other hospitals, take some of these patients. And, it seems like what's with FEMA? Isn't that the whole idea of having this in place where why are we getting nurses from out of state? Can't we just get the nurses from the hospitals that are local, that are empty? Why is there not this kind of shared co-op-y type of thing? And, why can't we just throw some of these patients in ambulances and send them to a hospital that's less than an hour away that's totally empty? I don't have the answers. There's probably a good solid answer to that, I'm sure, but
I just can't thank Jessica enough for sharing her story with me. We recorded this back in July, and at that time, I don't think we thought that here now, in January, when I'm releasing this podcast, that we would still be in the midst of this COVID crisis, and that we would be having places still surging and still getting very, very busy with COVID. So, what can I say? It's not going away anytime soon. I don't know when this is going to go away. Not soon enough for me, but hopefully the vaccine's going to start pushing us in the right direction. I hope you and yours are safe and happy in this 2021. Remember that self-care is an important piece of what we do. It's an important piece of maintaining your sanity. These times for ER nurses are harder than any other time we probably ever experienced. And I want you to give an extra thought to those new grad nurses or brand new finishing nursing school, maybe didn't even get a chance to finish their clinical experience. But sure enough, they are elbow to elbow with us in the middle of this COVID crisis. So be extra kind to them. Make sure to take somebody under your wing and teach them a thing or two while you got them there. I hope you're well. Again, I wish you and yours health and happiness in 2021. Thanks for listening to the podcast. I appreciate you always listening. If you haven't done so yet, please leave me a rating and review. That helps other people find the show, and that is a good thing. Share the show with people you love. Share the show with people you don't love. Share it with everybody. I appreciate you listening, and have a great show.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.